The psoas muscle is important for multiple conditions and presentations, including low back pain and kidney presentations. This technique is counterstrain for the iliacus tender point. The iliacus tender point is found by finding the patient's ASIS and standing on the side of the tender point that you've identified. The point is located 2 inches medial and 2 inches inferior to the ASIS. To assess the point, once you've localized it, the compression is not purely posterior, but posterior lateral into the concave aspect of the ilium. A positive grimace or report of pain would be a tender point that is positive and in need of treatment. And that can be compared to the opposite side. For demonstration purposes, we'll treat the right side today. The patient will be positioned again with the finger on the tender point for monitoring and rechecking. The patient's knees will be bent, and then the operator's leg or physician's leg put on the table with the feet of the patient crossed at the ankles for stability. Significant flexion and external rotation bilaterally is provided, which typically will resolve a tender point. However, if the score of the tender point is still greater than 3 out of 10, then additional fine-tuning movements such as side bending or rotation towards the side of the tender point will resolve the tender point to 3 or less out of 10. The operator's mechanics are important. Using the leg on the table, flexion and extension of both legs of the patient can be done, and using the hand on the ankle or feet will ensure external rotation of the lower extremities of the patient. As with standard counterstrain techniques, once 3 out of 10 or less is found at the tender point with positioning, that is held for 90 seconds. Keeping in mind the importance of restoring back to neutral, the patient cannot assist with the movement. Therefore, instruct the patient to not help in moving their legs, and the operator will bring the knees together and preferably lower the feet to the table first, and then slowly extend the lower extremities without the patient's assistance. Once returned to a neutral position, reassess the tender point for result and effect.